it's a model that everyone can relate to. There's certain aspects of it that everyone can relate to. And when we're all working off the same model, it means that we all are following the same kind of protocol procedure. The history behind the Minnesota model and the research behind it indicates that it's a really good treatment. And I think by the staff fostering that and, you know, speaking about it and educating patients about it and helping them get a really solid understanding of it, sending them back out into a sober life with a toolkit of recovery. The fellowship meetings that we provide for the patients and that we recommend the patients go to then all follow the same model. The patients know what to expect and know, you know, what they're doing. So I think that it is a really good model and it works, and we've seen it work. And the other thing that I think is a great aspect of the care here at Smarmore is the aftercare plan that the patients receive once they complete treatment, that they're going back out into the world with a plan in place. It can be a very safe environment here, and people often struggle with going back out, wondering how they're going to manage. We provide a 2-year aftercare plan here in Smarmore, so the person knows that they're still receiving support up to 2 years after they leave. And I think that that's so important for a patient going out, that they know that they're still supported even when they leave the gates of Smarmore. What I would say is keep an open mind. We often see people coming in that may have reservations, maybe something traumatic has happened in their life and they've pulled away from their spirituality and their religion, and that's okay. We don't force beliefs on anyone. We don't, you know, tell people that they have to believe in maybe what we believe. We want people to be open-minded and to maybe have an experience with the higher power. And higher powers to people can be loads of different things. You know, people automatically think of God, and it doesn't have to be God. It can be anything that you take power from. I've seen people coming through here, you know, that may believe in God, may not, and that's okay. But I've also heard people have put in their faith in something bigger than them, be it the universe, the sea, the ocean. So I think the biggest piece of advice I can give is keep an open mind and trust the process and see what happens. See what happens.
The 12-step, I mean, it's the program, the ethos of Smarmore is the abstinence model, the disease model, which is a 12-step model, so that this addiction is a dis-ease and not settled, you know, an unsettlingness, you know, not being at ease with oneself, and that really the solution here to this is abstinence. I have worked in harm reduction in that area for a long time, years ago, and in all of the instances working with people in harm reduction, you know, their goal, those that wanted to change, was abstinence. It came to that. That's why this model is the model that I, you know, subscribe to, because that's what's required. So the 12 steps is an abstinence-based model, and I suppose the work that we do here, you know, the most important one, well, I would say the most important piece is that step one, because people might come here that have had very little connection with, they don't understand that model, they don't understand any model, you know, a moral model, a disease model, biopsychosocial model. They don't understand what these models are. So they don't even understand sometimes that that's what this is. This is a disease model. It's an abstinence-based model. They know they want to stop, but when you put it out there that that's what this is, you're buying into this new way of living, totally changing the way that you live. And that's part of it. And it begins with step one. Step one being, you know, that we admitted that we're powerless over alcohol or drug use, and that our lives have become unmanageable. So it's getting those pieces, because that can be very hard. You know, it's difficult for people to even sit in a group and introduce themselves as an alcoholic. That's a difficult thing to do, and that's where it starts sometimes here. That there's a denial around that, and there's a hope that at some stage, well, I can go back and I will be able to. But that's not. So the 12 step really is that model. But we don't focus on the 12 steps here. We focus on step one, step two, came to believe that a power greater than ourselves could restore us to sanity. So I suppose it's step 1 and step 2. Step 3 comes into it also, but it's not really. I suppose step 1 and step 2 are really the primary pieces that we work on. Because when you leave here, and the great thing about Smartmore is there's a really good continuing care plan put in place for people. Great aftercare. Aftercare, for me, aftercare is such a vital piece. I run the Thursday night aftercare group here. We have aftercare on Monday. We have relapse group on Tuesday. Aftercare Wednesday. Aftercare Friday. So there's a really great support structure for people leaving here long term. In terms of the early recovery. Early recovery for me is 24 months. I view it that way. And Smartmore have that aftercare procedure in place for those 24 months. And I think that's invaluable help for the client. But just going back to the 12 steps, so, you'll have that continuing care plan, you'll have your sponsor, and with your sponsor, you'll actually walk through those steps. And most of the fears and the trepidation about going back out into the community, most of those fears are helped and answered and worked on in walking through the steps, all the way to step 12. So really, for me, the most important piece is to get that step 1 right, because if you have that, if you understand that the whole aspect of powerlessness and the understanding that life does become unmanageable, well, then I think you really have grasped the whole ethos of the abstinence-based disease model program, and that's what gets it off to a really good start.
So the 12-step program suggests that the alcoholic is powerless over alcohol and that their lives have become unmanageable. So that powerlessness is that they have this phenomena called craving and this obsessive mind state. And because of that, that's the reason why their lives have become unmanageable. Like I said before, if they don't know that they suffer from this, they've got no alternative but to live that way of life, which causes chaos. And that's so the first step is the word admission is all about the mind. It's about this cognitive process to understand that they need to admit that they're powerless over it at a really deep level as well, admitting not just at a real cognitive level, but really at a deep level. They need to admit that alcohol became a problem and that they can do something about it. It says in step 2, came to believe that a power greater than ourselves could restore us to sanity. Carl Jung, a psychologist in 1934, mentioned to the co-founders of Alcoholics Anonymous that he believed that that an alcoholic needed a complete psychic change in order to recover from alcoholism. And there was a doctor called Dr. Silkworth who believed that the action of alcohol was a manifestation of an allergy. Those people, plus the co-founder of Alcoholics Anonymous, if they happened to all meet in the same area, in the same town, in the same country, in the same year. And if it wasn't for that experience taking place, I think there wouldn't be such a thing as Smartmore Castle would be operating from a different point of view, maybe not using the 12-step program. I think back then they were using electric shock treatment, and they were also using the temperance movement was about and things like that. They were also using frontal lobotomy, which was brain surgery for the answer to alcoholism and things like that at the time. I'm glad today that we've got this process. So our patients come on board. It says in step 2, came to believe that a power greater than ourselves can restore us to sanity. And that's the concept of Carl Jung believing that alcoholics needed a complete psychic change. He believed that through the annals of history, that alcoholics are human beings who had a complete psychic change, usually had it through some form of spiritual experience. And he was trying to bring that about in the clients that he was working with around about the 1930s. So The 12-step program was adopted from a group in America, if I can remember the name of it, which was a 12-step program at the time. And the 12-step program, along with Dr. Silkworth, Carol Young and Bill W. and Dr. Bob, put together a whole 12-step program. The psychic change in step 3 says we made a decision to turn our will and our lives over to the care of God, as we understood. So it gives the alcoholic an option to define their own spirituality, their own God. And then you move forward into what's stopping a human being living a spiritual way of life or living a good, healthy life. And one is alcoholism, the way of life that I've been living, but it's also about not being able to live that moral with that moral compass. I think an alcoholic or an addict who's been drinking or using for a long time has lost a lot of morals. And the 12-step program, step 4 and step 5, begin alcoholics to start looking at the issues that they've accumulated throughout their lives and start to deal with those issues through one-to-one therapy, through the 12-step program, through family interventions. And there's a chapter in Alcoholics Anonymous that says, rarely have we seen a person fail who's thoroughly followed this path.
So the importance of the 12 steps in recovery is researched now, because we're talking about a model that's been here since the 1930s. So there's been a huge plethora of research that speaks to the strength of this 12-step model being very effective in terms of long-term recovery. When people read the 12 steps initially, sometimes they can become a little bit turned off by what they read, because the wording is old-fashioned, the concepts are a little bit old-fashioned. Notwithstanding that, there is a way to put a contemporary viewpoint on them. The 12 steps really addresses, it's not just about addiction, it's about living free from addiction. So the big, a misconception about addiction is it's about the substance. And actually that's a very small part of it. Once we remove the substance, it's about living a happy, free life without that substance or behaviour. And this is what the 12-step model enables people to do. So it's a philosophy of living. It's a philosophy of living a very happy and productive and free life from addiction. And with that, there's an established network, established process of deeper work as people progress from step 1 all the way to the 12th step. And the patients would always say here, that there is common sense in the way they're written. There's common sense in the program and the way the steps take people through the work. So there's only one of the steps will mention a substance. So only 1/12 of the steps is about the substance, which is the first one, admitting that somebody is powerless and that they are manageable in their addiction. After that, the substance is never mentioned. It's about living without the substance and addressing the issues. And AA themselves, which was the first 12-step program, said it in their book that alcohol was just a symptom. And that's where the steps really address it. They go to the underlying, and in a very holistic way, they help people address the underlying issues of living happily without alcohol or drugs. The 12-step program doesn't fight with any therapeutic modality. It's not there to do that. It's actually not professionalized in that sense. So the principles of the 12-step program is that it's other alcoholics helping alcoholics or other drug addicts helping drug addicts. So it wouldn't be right for them or appropriate for them to challenge any therapeutic modality. Having said that, I think they were way ahead of their time in terms of what they put out there. Because what we're seeing today as being evidence-based and what we're seeing today as being taken as acknowledged practice in best treatment for addiction was there since the 1930s, which is a CBT approach, which is an acknowledgement of responsibility. So we're into choice theory in a way, somewhere that. And it is actually a spiritual dimension. And spirituality has grown in 21st century. And we're removing religion from that as opposed to spirituality and embracing spiritual practices such as meditation. So, one of the steps actually requires people to meditate. Long before meditation was popular, long before it was discussed, it was a step for somebody trying to get sober in the 1930s. So I would say that the 12 steps, really, it's the world of therapy is caught up with them, not the other way around.
When I came in this time, I wasn't trying treatment again after that. If it didn't work, I was done. I was destined to go out there and just die from taking drugs. But it was utterly hopeless because I'd been so many times in and out of treatment, in and out of fellowship meetings, trying with sponsors, all different therapies, any way that you can think of to try stop drugs. I tried, except for the suggested things of the 12-step program. It's the only thing I didn't try. It wasn't until I was hopeless enough that I'll just do whatever is asked of me, and that's what happened when I came in this time. The same question was asked as every time I come into a treatment again. What's different this time, man? And this time I remember distinctively with our head therapist just throwing my hands up and breaking down. I don't know. I have not got a clue. If I knew, I wouldn't be sitting back here. Just show me and tell me what to do. And that was the beginning then.